Hi, I'm Colin Hung with Healthcare IT Today. I'm here with Hagai from Tytocare. I really was curious to learn more about what you're doing. The products that you were showing here is fascinating. Tell us a little more about what you do.
Absolutely. So we have a home smart clinic solution. Basically, it enables patients to get medical exams from home remotely. So you can look into the ear, you can listen to lung sounds, heart sound. The clinician can get medical quality exams remotely from home.
And why is this so important to be able to do this in the home?
You know, because we see that traditional telehealth, audio-video telehealth, doesn't really cut it.
Oh, okay.
Because you can't really look into the ear canal. You can't really listen to lungs. And it's important because without it, you can't really diagnose, or your diagnosis isn't necessarily accurate. In fact, we see 59% more accurate diagnoses, remote diagnoses, because we have these capabilities.
And what's the patient reaction been to some of these products in their home and using them?
Look, they love it because it really saves you. It's a convenience play. You don't have to go to the clinic. You don't have to go to germ-infested waiting rooms. You don't have to take a day off. And you get the accurate diagnosis that's required to really increase the trust in telehealth. Again, trust is a key thing for telehealth.
And what's been the provider reaction to the work that you're doing?
You know, we call it Home Smart Clinic because sometimes it's even smarter than in the clinic. You know, they see, they hear lung sounds better sometimes than the actual stethoscope. They see the ear canal, the throat, sometimes better than what they'd see with their devices. So reaction is great all around, and we see it in the utilization rate. You know, the proof is in the pudding. At the end of the day, our members, our patients, our providers use it.
And who are some of your customers? Are they payers, providers?
Yeah, so we work primarily with payers, with payviders, with value-based providers. We primarily work with risk takers.
Okay.
And the reason for that is we're able to reduce cost of care. We're able to divert ED visits, preventable ED visits. And again, we're seeing about 10.3 reduction in TCC, total cost of care, about 10.8 diversion of preventable ED visits. So it's evidence-based.
What's next for Tytocare? I mean, you're doing these kinds of things today, but what's on the agenda for tomorrow?
Yeah, there's a lot on our roadmap. I'd probably divide it into three. One is AI.
Okay.
Lots of diagnostic support mechanism. For example, we have wheeze detection coming out in Q1, and there's more coming down the road. Different modalities, so not just acute care, but also chronic. We have an asthma chronic condition management layer coming out in Q1 and more. And I'd say probably the third thing is engagement. So really optimizing the way we engage with patients to make sure that they actually use our solution. And we see it, you know, we have 5x the utilization rate of traditional telehealth.
Hey, listen, really appreciate all the information you shared with us.
Colin.
I'm excited. We're going to go and get a little demonstration
Awesome.
of some of your products now.
Perfect.
All right. Nate here is going to give us a quick little demonstration about some of these products. Nate, thanks for being on the program.
Thanks so much, Colin. I'm very excited to show you and the audience the Tytocare solution, which we call the Home Smart Clinic, specifically the Tyto Home Kit, where we enable virtual visits to occur remotely from directly within the walls of inside of a family's home. So what we have here, this is the Tyto Home Kit that would be sent to a health plan member or a patient of your local provider network, where they can enable virtual visits to occur at home with a physical examination. So I'm going to show you how a provider can actually prompt to see directly inside a patient's ear. Connecting the otoscope blue dot to blue dot, we're going to now have the ability to look directly inside of my ear. So into the left ear. There's the tympanic membrane, and I do need to clean my ear.
And Nate, where would this information go that once it's been recorded or shown on the screen? Does it go right to the doc? Is doc seeing it in real time?
So the doctor's seeing this in real time. This is your standard audio video only video visit on the left. But then they have access on the right-hand side to the images of the ear, listen to the heart and lungs with our stethoscope. They can see in the patient's throat. And we also have a blood pressure cuff to take blood pressure readings, a pulse oximeter for blood oxygen, and we can couple a weight scale with that solution to capture their weight.